Back with Dr. Pakman. Dr. Pakman, people go to a dentist, maybe regularly, maybe not so regularly. Anyway, they come to you and you tell them that they need what I think you call a deep scale cleaning. Basically, you need to go, not do surgery, but scrape relatively deep, more deep than a normal cleaning can go. A normal cleaning with a dentist I'm talking about, never mind cleaning at home. And the patient says, well, no, because it does cost more money, takes a little more time, and, people don't want to do anything too much. So anyway, they say, no, just do the regular cleaning, gotta be better than nothing, and I'm fine with it. Tell us what the consequences are, and is a regular cleaning in a case like that actually still of any value at all, or is it for all purpose worthless because you're not cleaning out the rotten chicken steak and the rotten eggs, which are like, I guess, just a couple of millimeters below, like chicken under the carpet. And if you don't take it up and grab it out, it will stay there and will stink things up. Tell us.
Excellent question. Excellent question. And I have encountered this in my practice, and all dentists do encounter this, where we will advise a patient to do the deep scaling and cleaning, and they just will not want to do it. What we try to convince them then to do is, instead of going to the dentist every 6 months, to come in every 3 months and get your teeth cleaned. It's not by no means a solution, but it is better than nothing. And at least we can monitor the patient more closely and try to advise them and move them towards the issue of taking care of their teeth in the way we advise them to. But of course, you can't hold a gun to people's heads. They're going to do what they want to do. We always make sure that they realize what the consequences of not doing the deep scaling is. And that may be eventual tooth loss. So if they don't want to do that, then I would advise them to come every 3 months and get their teeth cleaned.
Well, it looks to me that, if there is an infection so deep that you cannot grab it anymore, it'll keep growing, whether you, monitor it or not. I mean, you're just monitoring an infection growing, but the infection will still be there.
Exactly. And we always explain this to the patients. And then it becomes their choice. The patients have to be advocates for themselves. And sometimes it takes another family member or another practitioner telling them the same thing to get through to them. But you're right, that infection remains. We can minimize it. We can minimize it by cleaning their teeth every 3 months, and if they have some good home care, which, if they're in that periodontal condition, you can probably bet they didn't have good home care to begin with. But this is what we're up against, and this is what we have to fight against every day.
Well, I guess that's, why you're a doctor, and you have to, babysit us people through, because, as they say, if we're not educated, we don't know it, so we kind of go, I'll get it next year, almost like I get a better car next year. That might work because, you just not have such a good car, but you're not necessarily, or you're not at all getting more sick because of it. But with this...
Exactly.
You have your immune system.
And I often tell patients that the 5 most dangerous words in the English language are, maybe it will go away.
Maybe it will go away. My money always goes away. Of course that works. My money always goes away. Maybe it will go away. My money always goes away.
But that's what you're up against sometimes,
So it just doesn't go away because gum disease, once it's there, it doesn't go away without a knife.
It gets worse, actually.
It gets worse.
It gets worse.
Well, again, maybe I should just break up this interview and go to my dentist here and see what's going on in my mouth.
Run right over.
Run right over. All right, Dr. Pakman, thanks for enlightening us.
You're welcome.